Have you ever noticed that when life gets overwhelming, your body starts reacting, headaches, stomach issues, fatigue, or even flare-ups of health conditions you already have? What if I told you that's not a coincidence? Welcome back to Tawana Talk Psychology, where we break down the science of the mind-body connection in ways that actually make sense. First, a little about my background. I am a health psychology specialist and behavioral health strategist, passionate about bridging the gap between chronic illness care and workplace well-being. I am currently completing my Doctor of Psychology with a specialization in behavioral health leadership. I hold a master's degree in psychology with a focus in health psychology and additional specialization in industrial and organizational psychology. I am committed to sharing evidence-based insights to support chronic illness care, workplace well-being, and organizational health. I'm also master certified in stress and anxiety psychology, health and nutrition, sobriety, cognitive behavioral therapy, and rational emotive behavior therapy. Today we're talking about something that affects almost everyone but isn't explained clearly enough: how psychological stress and chronic health conditions physically shape the body. This episode is educational and rooted in health psychology, psychoneuroimmunology, and clinical psychopathology. Not medical advice, but it will help you understand what's happening inside your body and why your experiences are valid. In this part segment, we're going to talk about chronic stress is not just mental. Let's clear up a major misconception right now. Stress is not just emotional, it's biological. When you're under chronic stress, long-term financial strain, workplace pressure, caregiving, trauma, discrimination, your body stays in survival mode. Here's what happens physiologically. Stress hormones like cortisol and adrenaline stay elevated. The immune system becomes suppressed or dysregulated. Inflammation increases throughout the body. Blood pressure and heart strain increase. Digestive and autoimmune systems become vulnerable. This is why chronic stress is linked to heart disease, autoimmune flare-ups, gastrointestinal disorders, chronic pain conditions, frequent illness, or slow healing. Your body is responding exactly as it was designed to. It just wasn't designed to stay in emergency mode forever. Next, we're going to talk about stress and existing health conditions. Here's something many people don't hear enough. Stress doesn't usually create illness out of nowhere, but it absolutely worsens what's already there. If someone lives with diabetes, hypertension, autoimmune disorders, chronic pain, digestive disorders, stress acts like gasoline on the fire. Why? Because the nervous system, immune system, and endocrine system are constantly talking to each other. When one is overwhelmed, the others follow. So, if you've ever felt like your symptoms flare up during stressful periods, you're not imagining it. That's psychoneuroimmunology in action. This leads us to segment 3, the psychology of living with chronic illness. Now, let's talk about something just as important: behavioral health. Living with a chronic condition isn't just physically demanding, it's psychologically exhausting. People often face health fatigue, burnout from constant self-management, emotional overwhelm, difficulty sticking to routines. And here's the key part most people don't explain. Behavior change is neurologically hard. The brain prefers predictability. So when someone is asked to change their diet, take medications consistently, exercise regularly, monitor symptoms daily, that's not a motivation issue. It's a cognitive and emotional load issue. Understanding this removes shame and opens the door to realistic, sustainable change. Next, let's talk about lifespan health. Stress accumulates. Health doesn't start in adulthood. Stress exposure and coping patterns in childhood, adolescence, early adulthood shape how the body responds later in life. Unaddressed stress over decades contributes to cardiovascular disease, immune dysfunction, cognitive decline, chronic inflammation. This is why early stress awareness and behavioral support matter, not just therapy, but education and prevention. This brings us to learning more about behavior principles in health. Behavioral science also plays a powerful role in physical health. Small, consistent changes, reinforced properly, can improve medication adherence, daily functioning, symptom management, quality of life. This is especially important for individuals with developmental, behavioral, or cognitive challenges. Health isn't about perfection, it's about patterns. Now, let's talk about one of the most important areas: culture, stress, and health disparities. Finally, we can't talk about health without talking about culture. Cultural background influences how pain is expressed, whether symptoms are minimized, how healthcare systems are trusted, when help is sought. Systemic stress like discrimination, medical bias, or access barriers adds another layer of physiological burden. This isn't weakness. Before we close, I want to be very clear. This podcast is educational. I'm not diagnosing, treating, or prescribing. If something here resonates with you, the next step is talking with a licensed healthcare or mental health professional who can address your specific situation. So I'll leave you with this question: what signals has your body been sending that your mind has been carrying too much alone? Your body isn't betraying you, it's communicating, and learning how to listen without judgment is one of the most powerful steps toward better health. This has been Tawana Talk Psychology. If this episode helped you understand yourself or someone you love, share it. And remember, health is not just physical, it's psychological, behavioral, cultural, and deeply human. Until next time.